What's up, everybody? I'm Cassandra Hein coming to you with Dr. Thomas Rocco. Welcome today. Thank you so much for joining us.
Thanks for having me.
Yes. Now, Dr. Rocco is a general surgeon and he is an expert in CBD. And I just wanted to kind of put you on the program and talk about your experience with CBD. What's the background for those of you that don't know what CBD is, or for that are out there? Will you explain kind of what CBD is? And I think there's a lot of misconceptions.
There's a lot of misconceptions to it because it's obviously affiliated with the marijuana plant. I mean, you look at the type of medicinal effect from marijuana. It comes from cannabinoids, and it's either THC or CBD, and they work differently, but they work at the same receptors of our endocannabinoid system. The reason why CBD has that stigma is because of that association. CBD has no psychoactive effect, and the reason is they work at the same receptors. There's two receptors in the endocannabinoid system, but THC binds to the receptors, which kind of what narcotics do. So you get the effect from us not feeling or the receptors not working properly. What CBD does is differently. It makes the receptors work better. They work normally, but they function better. My analogy is like rocket fuel in a car. It's going to only make the car drive so fast, but taking too much of CBD is not going to give you the side effects of a narcotic or even THC, where you get hallucinations and paranoia. And obviously with narcotics, constipation, and then you stop breathing. So that's why CBD is a safe medication, but the stigma is the affiliation with marijuana and THC.
Right. And I have tried CBD, and I've also tried a mixture of CBD and THC, which is fun. But I do notice with the CBD that it is an anti-inflammatory. And, can you speak to, is that because of the receptors, or is it just naturally an anti-inflammatory, or?
Inflammatory, because what THC normally works with is the neural tissues. How CBD works, it works with the neural tissues and our immune system. And what it does is it helps with kind of anti-inflammatory effects in our body. With inflammation, a lot of it is certain cytokine production, and it helps make that cytokine production less. And that's how it acts as an anti-inflammatory. And that's why it works well for anything for pain or migraines. The anxiety effect is it makes you feel better. It makes your immune system feel better. It makes you feel better. And that's how it works.
So let's talk about anxiety for a minute, because I know with this COVID-19 going on, this is a big topic right now. How is CBD used to treat that? And is it used to treat anxiety?
It absolutely is. In fact, anxiety used at a lower dose than you do for pain, and a much lower than used for sleep. So for me, the way I describe it for my patients, it's CBD oil milligrams. There's different ways to explain. CBD is hemp extract oil, there's hemp seed oil. But for anxiety, all you need is about 15 to 20 milligrams. The best way, especially in anxiety attack, is using with a tincture, because it's going to work faster. And you can repeat it in about 15 minutes if you need to. With pain, for a normal adult, you might need like 30 to 40 milligrams. So with anxiety, it's a lower dose. It makes us feel better by boosting our immune system. It makes us feel better. It calms us down.
And what are the ailments that some of your clients or patients have that come to you and say like, hey, I have a lot of pain here or there? Like, what are you treating? What kind of diseases or ailments are you treating with your patients right now?
Most of the patients I have is pain, because it's kind of one of my backgrounds. I'm a surgeon, but I help patients with chronic pain with steroid injections. Try not to give narcotics. So pain symptoms is what I usually treat the most. It depends on the type of pain. If you're somebody that's in pain all the time, I usually tell them to take a capsule, and you want to take it on a light stomach so it gets into your intestine, and then it gets dissolved in the body, and then it works for about 6 to 8 hours. And then I tell them to have a tincture available if you need something extra, which is going to work quicker. So for somebody that's in chronic pain, I usually try to get them a capsule morning and night, and tinctures as needed. If it's somebody that just has pain intermittently, somebody that's kind of a construction worker and gets his pain, he's feeling fine all day and then pain comes, I use a tincture, and that's the best way because the effect's going to be quickly. But the cheapest way to do it, and if it does work, is topicals. If it's just one localized place, it is the cheapest way to do it. You have it on hand. It usually works pretty quickly. So normally people that can't afford the expense of it, we start with topicals to see if that works.
And is that like for carpal tunnel or like your back pain?
Patients with chronic back pain, I tend to have them take a capsule in the morning and the night, and then use tinctures in addition to help with the additional pain they have, just to give them a CBD dose during the day to help with inflammation. And that's for patients that have wake up with pain. I'll give you, for instance, I have a patient that has MS. She has muscle stiffness. We tried a capsule in the morning, it didn't help. So what we do is the first thing she does in the morning, she takes a capsule and a tincture because it takes some time for the capsule to work. And in the meantime, the tincture gives her a good boost immediately, and that helps her during the whole day. And then at nighttime, with her symptoms, she does take a THC product to help her with sleep. So it works out perfectly. It depends on what you need. But if you're somebody who's a young guy and you're doing labor work and you have this acute pain, I wouldn't take a capsule. It takes too long. I would take the tincture. It works much quicker. You get the absorption under the tongue, and in 15 minutes, you should be feeling the relief. And if you don't feel it in 15 minutes, you can repeat it again in another 15 minutes.
That's great. Now, your background, I know that you said that you're a surgeon, and I'm kind of curious about how did you go from traditional, pharmaceuticals into wanting to really take this on and make that a part of your practice?
Well, what happened was I kind of backed into it. I had a patient who needed help at a facility to help educate on medical marijuana. And they begged me to help because the doctor that was doing it had moved, and without this person, the practice would have kind of, stopped. And initially, I didn't want to get involved because I knew nothing about marijuana. This is 10 years ago. And so when I got speaking with this family that started this practice, they were doing it very legitimately, which really I liked it. And they're the only practice in the country that has a license with the Department of Health to educate on medical marijuana. And it took us, after I started, about 3 years to apply. It's not easy. Did absolute, all of these meetings. The only way that really got us the license was we brought patients into how it changed their life. So I learned medical marijuana, honestly, through my patients and going to some conferences. But in the meantime, the last couple of years, CBD has become such a big kind of product for patients without any education. So I started this website to help me actually learn more about it. And now I can disseminate it to our patients. And it definitely has a role. It really does have a role. We've seen some really good outcomes with it.
Well, that's awesome. I think that you're helping a lot of people in an alternative way. And I think that's really needed out there, especially by professionals that really know what they're doing, and doctors. And it is really saturated market in California, at least. And, but, I've tried many products, and I do notice a difference in sleep. In fact, I'm like, shoot, I should be using that. I woke up last night at 3 a.m. I've been up ever since. I was like, I need to use that tonight. But yeah, with your practice, Dr. Thomas Rocco, you're doing free consultations right now, right? Tell us a little bit about that.
So with these free consultations, I usually take about 1 or 2 days off in the month, full days. And we make appointments with patients that want to learn more about it. I think it works best that way than anything else, sitting down, going over how CBD works, how it works with THC, and then how it's going to work with them, specifically with their symptoms. But a lot of the education comes with how to know what to buy. Again, just a quick thing is hemp seed oil. If you see hemp seed oil, there's no CBD in hemp seed oil. It's the pressing of the seed. It's great for skin products and food products and oils to cook in, but there's no CBD in it. But if you Google CBD oil, hemp seed oil pops up, and it could be no CBD, and you're kind of misled. There's 2 other ways to explain CBD in a product. It can either be CBD oil milligrams or hemp seed oil. I'm sorry, hemp extract oil. That does mean there's both CBD in the product, except that hemp extract oil means how much of the plant is being used to make the CBD oil. So there's a couple of my products that we talk to about patients, it'll say 9,000 milligrams of hemp extract oil, but that's not how much CBD is in it. What's really in it is 1,500 milligrams of CBD oil. So we're trying to get them not to know only the dose, but how to buy it correctly so you know the right dose that you're getting. So I like being face-to-face with talking to patients because they can see the products that we have and know what to do out in the public.
Right.
And then, then what I do is then after I've seen them, I'll call them in 2 or 3 weeks to see how they're doing, just to get education from me. Is it working? Is it not working? Do we need to do something differently?
So right now, if somebody goes to your website and they want to get a free consultation, where do they go and what should they do?
They should, if they live around in Rhode Island, they just call our number, 401-678-6420, or if it's from far away, I mean, they could just call them. Today with the COVID-19, instead of people coming in, I mailed them all the information and we're doing it on the phone. I'd rather be in person. It's so much better. I'm a people person, but if you have to do it on the phone, you have to do it on the phone. So
yeah, well, also maybe you could incorporate some Zoom calls now that you're doing Zoom.
I know, I've never done this before. This is kind of
yeah, well, maybe we could, there's more opportunity for collaboration, and maybe we could host something to do some type of, educational program if people are interested. So
right.
Tell us your website again.
So the website is back2basicsllc.com. It's BAK2basicsllc.com.
Well, thank you so much for giving us the education today about CBD. We really appreciate it. And we look forward to possibly collaborating more and getting more information out there to the public.
Great. I actually love this. Thank you so much.
Thank you.